Welcome to the second session of the MAMES 2020 Connecting the Space Between Us virtual conference and exhibit hall event. In this session, you will be hearing from Miriam Lieber of Lieber Consulting, who will compare work from home and work from office situations before, during, and after the COVID-19 pandemic. She will talk about holding people accountable in the remote work from home setting, and we'll have a discussion of current best practices in a remote setting. Miriam is an independent consultant specializing in operations management for the HME industry. She brings over 20 years of experience in the field, where Miriam has focused exclusively on home healthcare reimbursement and operations. She is well known for her practical advice and creates efficient operational procedures to cope with complex regulatory changes. Miriam's consultations and seminars focus on developing efficiencies in a cost-cutting environment. She has worked with over 500 providers and also works with payers, manufacturers, and distributors. Miriam's reputation as a leader and expert in the field absolutely precedes her, and we look forward to hearing from her now. So with that, Miriam, I will pass it to you to share your wealth of knowledge and to acknowledge today's session sponsor. Take it away, Miriam.
Sarah and MAMES for having me here today. I'm so excited to be able to present, albeit in a virtual community, but I am always thrilled to be a part of MAMES regardless of the modality. So let's make the best of it and we'll go from here. I'd be remiss if I didn't say also thank you to my sponsor today, AccuServe, and I am grateful to them for understanding the importance of education, especially today when we're all kind of stuck in various places around the country, and all the more reason why we need to be a community in educating ourselves. Which brings me to the topic for today, which is accountability and best practices in a work from home setting. I can't think of anything more pertinent, to be honest, than that. I suspect that you've all been visiting with this throughout the pandemic, and also just thinking about ways that things will stay the same and ways that they'll actually sort of change forever. That's what really prompted this session, and talking to many of the members of MAMES and of course to providers around the country, I bring back my findings and the best practices in a work from home setting, and also my good fortune to work with your companies throughout the pandemic in a consultative way via Zoom. So I'm acquainted with Zoom, and I'm beginning to get to know it. I better like it because I think we're here for a little while. So anyhow, let's go ahead and get started. You will note that the objectives for today are looking at the work from home, and I'll be abbreviating it to WFH just for readability and easy to follow. Acronyms, just another acronym in our alphabet soup in HME, but we'll examine the work from home versus the work from office setting. We'll talk about holding people accountable, and we'll also look at current best practices and lessons learned. And I wanted to just sort of give you a little background on my preparation for today, in addition to the two companies with which I've consulted in the last 60 days. I've also tapped into the resources of some of you at MAMES, as well as providers at large, and some of the other sessions that I've prepared for. I've sort of consolidated them all and synthesized them into these findings. And in addition, I've obviously done a ton of reading, just like you. So I feel comfortable telling you what I learned. So let's get going. One of the things that I wanted to share with you is this staggering statistic that I found. 73% of teams will actually have remote employees by the year 2028. What does that mean? Wow. That's an incredible figure. Now, in some ways it's kind of like, well, it's not really that different, Miriam, than what we already know, but no, true. Speaking with some of you providers in the last several weeks, I got this really clear clue that work from home was not something you were at all interested in nor engaged in. Not all of you, but some of you. And the thought of having people work from home without control was just something so foreign a concept. But then when it happened and we had no choice, you got on board. And as one provider said to me last week, we did a 360, Miriam. We now love it and it works, and far be it from us to condemn it. In fact, it might just stick. So let me just say, according to the Bureau of Labor and Statistics, that staggering stat right there, 73% of teams will have remote employees by 2028, is something that speaks volumes, especially in our environment. Now let's look at work from home for a moment. I just wanted to sort of set the stage. You know, back in March when this all kind of erupted, it felt like a volcano, maybe it still does, maybe for some of you a nightmare and then some. The challenges were as follows. First of all, and I want to add a couple thoughts, but the challenges in work from home were less than ideal for some of you. You know, home situations are not the same across the board, and I don't want to speculate what they are or aren't. I just wanted to say that I recognize that it's not so simple, and that, you know, employees working from home may just feel so out of touch. Other employees love it and have always worked from home. Some feel like access to information is just hard to get. They're not sure who reports to whom and who's responsible for what. In fact, I have one example. When working with one of the companies with which I consulted, they had at the sort of in the sort of first quarter of this pandemic, they didn't know who was going to handle like the claims that had to actually be mailed in, or those things that actually had to go old school fax, or things that, you know, that were just administrative in a manual way and were tasks that were formally handled in an office setting where you could give it to an admin. Who was going to do that? And so it was sort of like, should I email it? Should I send it? Should someone pick it up? Should I drop it off? Those were things that had to get ironed out. And I think it took a minute. I also remember doing a Zoom call with someone who, and I was able to share her screen, which was amazing, and listen to her call an insurance company for verification of benefits and eligibility. And so picture this, I'm sitting there watching her screen, much like you're doing mine, and all of a sudden I see her like sort of getting up like I am and looking around and hold on, I'll be right back. And she's on the phone with the insurance company. I'm getting a little nervous. And what happens? She was actually looking for the various tax ID numbers for their companies, because they've acquired several companies recently, and she couldn't remember which was which and which company she was asking about. And at the office, it was like literally on her, you know, on her desk, splattered right behind her, her computer. And at home, she kind of had to figure out where it was, and she couldn't remember. She couldn't get, you know, find it easily accessible. That's what I mean by it's a little more challenging. And that's just one small example. But even just from a logistics perspective, when you don't have a lot of space in which to work and you're not really sure where things are, or, you know, after a while you get used to it and you put it in a place that feels comfortable. But just when things change, you got to kind of adapt. And flexibility is the key here. I feel like with flexibility, I think everyone sort of needs flexibility. Internet goes down. What do we do about that? You know, we got to figure that out too. We might have to dial back in. Hey, you guys, you know, I had a call yesterday. We may have to dial back in. I'm in a remote area. Okay, so we dial back in. What can we do? And then let's move on to things that really are super important and to the mental health of an individual working from home. Feelings of isolation and loneliness are real. They're real, and they are pronounced and can be exponentially greater in a work from home setting. It is possible that that person working at home had the only human contact was in the office, and now they're subjected to that same desk and chair and in a little tiny space all day long. That's tough. Socialization, even getting up at lunch just to sort of say, where anybody bringing food in want to share, that might be how they socialize. Gone. just gone. Maybe now we have to do it in other ways, but I just wanted to set the stage. And some of the concerns that we worried about: laptop setup. One company I was working with said, I got to get 150 laptops deployed to employees at home in various areas, not even within this exact region. I got to do that, and I got to do it now, and I got to do it fast. And so they had to have a whole task force just on that. And then, of course, the distractions at home, you know, kids and television and insufficient space, et cetera, are real. In fact, in one article I was reading called "Are Companies More Productive in a Pandemic?", which I'll be quoting from in a minute, by David Gellis. One of the quotes that I didn't list in the handout says, some individuals have had a harder time than others working from home, but many companies say productivity has remained at pre-pandemic levels. Without long commutes, small talk with colleagues, and leisurely coffees in the break room, many workers, especially those who do not have to worry about childcare, are getting work done. Childcare is a real deal. Getting interrupted by kids and dogs and the like is just not simple. And so I think the reality is we just got to be flexible. And I find it kind of humanizing to see people and their kids. I love it so much. I think it's endearing, and it gives me a sort of a lens into a real personality and what makes that person tick. So I kind of like it. Internet inadequacies are quite frustrating, and I experience them. I assume we all do. That happens everywhere. Even within a Zoom meeting, by the way, if I want to share a document, sometimes it's challenging. I'm hoping it doesn't happen here, but well, let's just roll with the punches, as I say. Surprises, and by this I mean like pleasant surprises from the pandemic, especially initially. Better than expected productivity, like it was good, especially at the beginning. Eliminated commute time, driving back and forth. Now, some of you may say, Miriam, for me, that was like my quiet time, my time to decompress, my time to gather my thoughts, my time to listen to music and zone out, almost meditative in nature. No longer do I have that. So for some of you, it's a downer, and for others of you, it's quite exciting not to have to commute. And for me, I'm in a big city. I have to say, not having traffic has been a welcome relief. Less excessive socializing and breaks. So we were saying before, some people are lonely and needed, other people used it excessively. And then shorter and more efficient meetings. You know, I think that that's a reality, that there's less meetings necessary because we are already working from home and we know our goals. And for other people, there are more meetings necessary, but they take place more efficiently is what I'm hearing. So some of the primary things we needed initially, you know, we talked about the laptops from home, et cetera. In speaking with a couple of providers, and these are some of my takeaways, they said we had to have phone system reporting, inbound, outbound, dropped calls, voicemails, excessive voicemails. Those are hard to control in a work from home setting. So Miriam, we really, really needed that to be in order. So we made sure of that as we were rolling out our sort of pandemic and COVID sort of requirements, and almost like a task force. The phone setup, we had to set up internet-based phones, and, you know, even you know, talking to you from Zoom, so that had to work out right. And the internet had to be strong enough to be able to be capable of that. And by the way, when you have many people working from one home, that drains the internet. So those factors had to be considered. Billing software, we have to have billing software, we know that. Or maybe even if you outsource the software, you have to have good reporting regardless, because we have to be able to measure against productivity in a way that we can't just walk up to someone's desk and ask them for something, or ask them a question, or get a report. And then productivity measures, just in general. What were you doing for productivity before? And this guy said we were all over the place with productivity, so we knew exactly where we were, which was kind of nice, because then we could measure our productivity during the pandemic and measure it against where we were before the pandemic, which is, of course, a great for a case in point, especially in doing studies. And so a couple other people I spoke with said we actually formed task forces, and one of them had one I loved the name of, Business Continuity Committee. I really like that. It sounds very professional, and it makes you feel like we're in this for the duration. We're going to get it done right. We're going to create a task force, and that's exactly what they did. This task force helped in daily tracking, whether it was number of invoices, orders, deposits. They knew how much, they knew when and how and where, and they kept tabs on it so that they were held fully accountable and responsible for keeping track. They constantly examined cash flow and other business measures so that they didn't lose sight of it during the pandemic. Well, as their cash in the bank, as they're not cash in the bank. Are we going to use the loan? Are we not going to use it? What are we going to do? Are we going to take the PPP? What are we going to do with, with the extra money, et cetera? And it gave people tools for use in the environment. So this committee got together and said, what are some of the tools that people need? And they obviously laptops, but what else could they benefit from? And one of the things that they said that they did constantly was they surveyed staff for feedback. Google survey is so easy to use, and it creates these amazing forms, and it gives you quantifiable results, and I find it fantastic. In fact, someone in our communities, their daughter just graduated from college and she doesn't have a job, and she's decided to go back to school, but in the interim, she loves to bake. She's making money by baking cookies. So I said, you know what, I'm going to order a dozen cookies for my daughter in college. I'm sure she'd love that. And I want to help out this young kid who just graduated. Sure enough, I got a Google survey, and it asked me for my Venmo handle and what message I wanted to say and any notes I might have had in addition to all the other, demographic information. And I thought that was great. And now she can go back and measure against that because Google gives you those results. So you too can do it. It takes 2 minutes to figure out. And then based on the results of the feedback and what their needs were, they actually created action plans, and it's fantastic. And I love that you're surveying your employees because they do this day in and day out. They know best. They really know best. Some of the fun things that I heard about, in fact, one of my clients with which I consulted, one day I'm like looking at it and I'm peering in, I'm going, what are you wearing? He's like, a cap. And it was the name of his company. And it was so cool because when I spoke to all the other people in his company that day, they all had their caps on. In fact, the next time I called them, they all had mugs, and their mugs were the name of their company. And I loved it so much because what it does is it creates this sense of community that we so desperately need. It makes you feel like you're in this together. It makes it feel like we're all one company. And almost like this built-in camaraderie and bonding that sounds kind of goofy, but how great. And then he said one time he sent out stress balls because what the heck, why not? And it had, of course, the name of the company. So it's just great advertisement. And then it's also great for the bonding. Some of the other things that they did cooking classes. This was somebody else who told me they have executive cooking classes. That is so cool. I don't know about you, but I love cooking, especially now. And so they created these cooking classes, and they've been really great for sort of community building, exercise groups, whether it's yoga or otherwise. I know that I subscribe to an online workout class called Mate to Go. And, it's kind of goofy, but it gets me where I have to go, and I just do it. I attended one meeting where there was a band. And the band was awesome, and it was so much fun, and everyone grabbed a beverage and hung out, and it was fantastic. That was really cool. Virtual picnics. You could all sort of get together and have a virtual picnic. Group pizza, where they were delivered to each person's home, maybe on a team, maybe to thank them for a job well done. And everyone got to have pizza together in a Zoom meeting or Slack or whatever. Games. Someone told me that they did a game called 3 Things You Don't Know About Me, and everyone had to guess who the person was. And it was just kind of goofy again, but really fun. We've taken to a game called Code Names. It's kind of cool, but it requires, you can do it online, but it's a little tricky that way. And book clubs, book shares, article shares, things you've read, things you loved. I love that, of course. That speaks to me. And oftentimes when I'm mentoring young leaders and supervisors in our industry, I share books and articles that I've loved and hope that they take me up on that and read them. Sometimes I even send them. So let's get back to so what do we do for productivity? And one of the things, by the way, I was remiss in saying when I talked about some of the great benefits of work from home, I forgot to say that our outfits, we don't have to dress up. Of course, I don't know what you're wearing on the bottom. I just know that I have a nice top on today, and I don't really care. Although people make jokes all the time. Apparently, in one of my seminars last week, they were laughing about it. But also, I think it saves on money that way. Also, you're saving on brick and mortar space. And so for some of you who are bursting at the seams, no longer do you have the need to add on space. In fact, some of you have a ghost town going on in your offices. Others of you have people spread out, and it's working out quite well for those that have returned. So anyhow, we'll talk a little bit more about that later. But when it comes to productivity measures, I have to say, many providers state that they've seen productivity improvement during the pandemic. Not all. In fact, I've gotten emails from people saying, Miriam, what are you hearing out there? I primarily hear that people are seeing increased productivity. And by the way, more at the beginning than now, because like any habit, like as things go on, you get excited at first, you're so driven and focused, and then all of a sudden it's like, wait, am I still doing this? And then it starts to wane a little bit. So where I heard, like in one example, 10% initial increase and more, now it's at 7+% productivity improvement. Not quite as robust, but still nonetheless really good. And then, key measures. I just wanted to throw a couple out there. What are some of the ways that you're measuring your staff? Number of initial and resupply orders, for example, of course. Outstanding documentation. Initially, it was delayed significantly, and now it should be back in gear. Doctors are back, not in full force, of course, but you should be able to get more documentation than you were getting initially. Delivery method comparison, so like where I have contact list delivery versus outsourcing my delivery to a courier necessarily, or your own if you're delivering, or if you're just requiring people to do pickups to your location, drive-by pickups. And we all take part in that now, wherever we go. We have Lowe's and Home Depot, we do the same, where we're going, either it's contactless or we're having it delivered. And how many of you have, the big Amazon deliveries all day long? So just confirming how the comparison to delivery methods is either helping or hindering you. And then confirmation of orders. I'm hoping that they're starting to hasten now, that we have doctors back for the most part, not totally in some areas. And then of course we're tracking denials and AR. These are just a smattering of the ways in which we can measure. When I talked to one person, they said they have, Miriam's like, we have 30 dashboards that we use. We are totally measuring against how well we're doing or not. And we always have had comparisons, but now it'll be an interesting comparison this year. And then year over year, we'll see what it looks like. But I'll say one thing for sure, that accountability is a must. I mean, there's no way we can do this, especially remotely, without accountability measures. And one of the things I wanted to remark on, and I'm seeing throughout the companies I'm consulting with, is we need to empower staff a little bit more, like let them get their own reports. They should be able to grab them. They should appear as dashboards. They should have tasks and work lists just appearing for themselves, or going in and grabbing them. And most companies are now working from tasks and work lists. It's just, rather than using Excel spreadsheets, I'd much rather see the system be generating the reports. And of course, if you can't rely on the integrity of the data, you have a bigger problem, and that's something we could discuss later. But allow your people to work independently. Where you have supervisors doling out work just seems archaic to me, and also it's spending really expensive resource where you shouldn't have to. So I wanted to bring that to your attention simply because I've been seeing it, and I'd like not to have that happen. And then, I do have to say they don't have that human contact. The task and work list doesn't replace it. I still think you need to have it, like some kind of a daily check-in with them. I hear some people do every other day, some people do weekly, but I just wanted to bring that to your attention. I see that as well. And again, from a productivity standpoint, I don't think I could talk about this enough. I could keep going for all day on this one, but I wanted to say software tracks employees' activity. Where people are measuring again on Excel, I'm finding it that it shouldn't be necessary. So your systems today actually know even keystrokes and how long people are in the system and out of the system. And I encourage you to tap into that as a resource for you to measure the productivity, not because you're narking on them, but because you want to be able to measure one against the other and how long it takes on average to complete a task. So I think it's super important to be able to go back and say, wait a second, we're spending so much time on this spreadsheet and tick marks and the like. Why don't we look at what the system has to offer? Because I venture a guess that you have that. And if you're using an outsourced option, ask them for activity and how well they're doing and then what they're getting done. You'll know by way of reports. And again, the dashboard measures that we talked about. I love the idea of it being real time and dynamic so that I know, oh, I'm at 34% of goal, I got to get to 80%. And sometimes when I talk to your employees and they tell me that, I get so excited because they know how much more they have to get done and they know how long it'll take them in a day. And honestly, one of the things that I learned is that people just want to work whenever they want to work, and who cares? If they get their work done, far be it from you to condemn them for what hours of the day they work, unless, of course, they need to get a hold of an insurance company that might be closed or whatever, or a customer that can't answer the phone at a specific hour. But when they do work that doesn't require that, then get it done. Just get it done. That's what I'm most interested in. And if we have the right staff and we have the right leadership, that should happen. And one of the things I wanted to mention here also is please segregate your tasks by skill set, because, you know, we oftentimes use really highly skilled people on administrative tasks. And I gave you that example before where the supervisor is giving out the jobs for the day, the daily tasks. That's just improper use in my mind of really talented staff. They should be motivating people to do their job, if they have trouble meeting their goals, helping them, measuring against the goals, doing reviews with them on a regular basis of how it went and what they need done differently and what they can teach them to make it easier, and how they might help them to become more productive. And they may have their own jobs themselves to get done, but just so you know, I suspect that you have a difference in wage and benefits for people at higher levels. And if you don't, you ought to. And then you're paying them accordingly. So don't waste the money is what I would say. By the way, also unsuccessful staff, you'll know it because, you know, if they're unsuccessful, then they know it and you know it because you have KPIs and you have benchmarks. Maybe they're just in the wrong seat. Isn't that interesting? Maybe it's the lesson learned is that maybe you should have put them in a different place. Maybe that customer service rep is better at billing, or maybe the biller's better in customer service, or maybe that person's not good on the phone with people. Let's give them projects. They're so smart and they're so talented, but they just don't deal well on the phone. Let's give them great projects and analytical things that will really get us far. Maybe they could be part of the measuring and the productivities exercises that we actually might want to use during our onboarding process based on what their findings are. So you can see there's so many ways to find better use of people if they're not in the right place. And by the way, I'm not saying everybody is the right person for the job. I don't say that at all. But what I do say is just beware. Sometimes you just have people in the wrong seat on the bus. And I was reading an article just the other day, and it was called "Are Companies More Productive in a Pandemic?" I think it was from the end of June. And at this one company, it's an online learning company, Chegg. I hadn't heard of it, but I looked it up. 86% of employees said their productivity was as good or better than before, according to one of their internal surveys. So maybe that's something you use as one of your key questions when you survey your staff. They attributed the uptick to not commuting and not having boundaries to the workday, like I was alluding to before. Maybe they work at different hours than they were working before. And that same person at Chegg, named Nathan Schultz, he was a senior executive there, said he was so convinced that productivity was going to plummet during the pandemic. And lo and behold, he said, I'm just going to smother them. He said, I was trying to replicate the many touch points you have in the office environment. And so he realized pretty early on that wasn't going to work forever. So what he did was he said he realized that some have a harder time than others working from home, but many companies say that productivity has remained at that pre-pandemic level. In fact, Cisco, a very large company, the chief people officer there, Fran Katsudas, says we're seeing an increase in productivity. Customer service reps, which of course we have in common with them, are taking more calls and customers are more satisfied with the help that they receive. And this was from data collected at the end of June. So I thought that was an interesting article and one that I wanted to share a quote from. And then this is from information that I gathered in our industry, specifically where people were working from home for all these months. What's going on now? So my question to you is, what is your return to work plan? Like, have you begun executing on it? What does it look like? And I actually loved talking to one of my clients where I mentor some of their leaders, and she said to me, look, we're staggering it. We have a 3-tiered approach, or 3 levels. The first people that go back to the office are people that, are not at risk, are not high, don't have comorbidities or anything like that, are not at risk, don't feel immunocompromised, and who don't have kids at home and are able to come in and wants to come in. The second wave are for people who might have kids at home, but they have help in the home or they can get out. And then the third wave is for everyone eventually, who knows, but they were between stages 1 and 2 at the time we last spoke a couple weeks ago. What's yours? So one of the people I spoke with, also a provider last week, said that they were at 80% still work from home. Others told me they were at 50%. And again, the staggering of the return to office, I think, is a really interesting approach, and one that I really like, actually. I think it's pretty cool. Now let's look at like the risk factors. I just want to make sure we're sensitive to that. And some people might not want to share with you what that is. You decide what that looks like, but I wanted to bring that to the limelight. Really important, managers, leaders, I should have put leaders, but whoever you are out there, and hopefully you'll be attending with us, but the leaders are people who do daily video check-ins. In one of my meetings last week, we talked about the requirement to do video check-ins. It's like not even an option, which I thought was so cool, because they want to see their faces, because you find out so much more. I mean, if you think about it, if you look at my face and I'm like this, and I'm like this, and I'm slouched over, or literally tears running down my face, or I'm sort of on the screen and sort of not, what's going on, I'm disheveled. You're going to want to know what's up. When you do your daily check-ins, one of the things that we discuss in my mentoring calls is that ask them how they are feeling in a general sense. How are the kids doing going back to school? Did they go back? What's happening? Is it Zoom? Are you doing their homework, or are they leaving in the middle of class? What do you do with a first grader, for God's sake? That's impossible. Just listen in. Are they getting back to sports? That's so cool. How's that going? How does that feel? Is it weird? Oh, someone on their team. Oh, exposure. Ooh, what are we doing now? How do you handle it? Find out what's going on with them before you start with the productivity. You may know anyhow, because first of all, Zoom and Teams, Microsoft Teams is helpful. You guys have whatever method you use. My husband uses something called Blue Jeans. And then there's others called Life Size. There's all kinds of mechanisms and platforms to use to do check-ins via video. And Slack for chat rooms is really the most common chat room platform that I hear about. It's great for socializing. Some people just go online just to say, hey, what's going on? Or they learn something and they want to share it. And so they put it in Slack and see if anybody else had heard about it. Oh, can you believe this insurance company is doing this now? Or, oh my God, they cut us off. Or they don't require that prior auth anymore. I can't believe it. I thought they did. So those are things that you learn about. But again, don't forget, their emotional well-being is probably, from all the calls and meetings and readings I've done, that one shines through as something really, really important that we cannot neglect and that we need to pay particular attention to. And then, of course, setting expectations. In some of my readings, I was saying, it was saying, set the expectation, out of the gate. Like, as your leader, I'm available. Look, if you have an emergency, I'm available 24/7, of course, or at least till 8 o'clock at night. And then some of you might say, you know what, I check out at 5. I'm so burnt out with the Zoom thing. I'm good. If it's an emergency, text me and I'll call you. or why don't you email me, or why don't we use Slack, and if there's something that's important, let's find another way to do that, or put an exclamation point or something and I'll know that it means something more. So you can see it's all over the map, and people are all over in terms of their needs. The place, places are different, staffing is different, personalities are different, behaviors are different, moods are different, situations are different. Adapting to each of those is really critical. One of the things that I read in a Harvard Business Review article from the beginning of the pandemic, in an article called The Guide to Managing Your, quote, newly remote workers, it says that, research on emotional intelligence and emotional contagion tells us that employees look to their managers for their cues about how to react to sudden changes. And they go on to say, if a manager communicates stress and helplessness, this will have a trickle-down effect on employees. That's profound, and it's so true, and we see it all the time, and maybe it's not an aha moment for you, and maybe it's just par for the course, but yeah, of course. If you're in a mood, they're probably going to sense it. No different than when you were in the house, in the office. They might not be able to sense it, and that's why video check-ins are helpful. They're not the be-all end-all, of course. I can disguise it, but it's harder to disguise. So I would suspect that you want to do the video check-ins in these particular cases. And if you want to grab the article, I think it was from March, but even so, I think it still resonates today. So when I start looking at goals, this is me and my beliefs. You got to work with your staff. We talked about managers and behaviors that you model, and how there's a trickle-down effect. And the truth is, I'm finding more and more as I start to meet with you via Zoom and doing consulting via Zoom, I'm finding that that's so true. I speak with the managers first, and as I watch them in their tracks, I'm thinking, I wonder what I'm going to see with their staff. And sure enough, I see staff repeating that manager level behavior. So keep that in mind when you come into a Zoom call or when you're interacting with your staff. And also, emails sometimes get misconstrued. So if you think it's going to come off wrong, A, don't send it. B, wait, and then C, pick up the phone if you think it warrants a call. And then when you're setting goals, you got to engage the staff. You got to work together, because I believe wholeheartedly that if the staff feels like it's theirs to set and theirs to be a part of, at least in the setting of the goal, they're going to have buy-in, and you want maximum buy-in because you get productivity. And if they feel deserving of it because they were deserving, you allowed them the space to come in and actually help set the goal, then they're going to want to own it. They have that ownership mentality. Hey, I want to do it. I'm going to do it because I said I could do it. Don't we all get like that? I hope so. At least the people on your staff that want to do a good job are going to be those types. And also, I was going to tell you that companies, larger companies with which I work, they have stretch goals, not just a goal, but what some of your people just want to even do bigger, better, more, or they've exceeded goal 3 times. So have a stretch goal in there for fun. See what happens. Some of them actually every once in a while reach the stretch goal, and let them know that it's exactly that. It's a stretch goal. And then reward them based on achievement. But reward is different for all different companies for all different reasons. And sometimes it's monetary, sometimes it's a gift card, sometimes it's pizza lunch, sometimes it's a pat on the back, sometimes it's a merit bonus, sometimes it's a promotion. It could be all different things. But beware of those where you give the same kind of quantifiable, measured dollar figure reward every month, because if they reach their goal every month and then one month they don't get it, they're going to feel like they lost their salary and they come to expect it. So what I like to do is mix it up periodically and maybe even regularly. If you're going to have some kind of a reward, maybe it's on a different kind of a goal or a different achievement. Also, don't have too many goals, because it gets mixed up and then it's just too hard to measure and you're spending all your time measuring for the goal. Of course, optimally, the system should be able to measure the goal. And I am a believer, by the way, in healthy competition. I think it's cool to have competition. I think it should be healthy, and I don't think it should be he said, she said, pointing fingers, but a little bit of a healthy competition can go a long way. When it comes to accountability, I have to say, right before the pandemic, I attended this really cool session at the Pepperdine University MBA program, and they have these speakers from time to time. And they had the CEO of Kellogg Company, in addition to getting, talk about swag, we walked away with so much food, it was great. But this guy said the following, and I wrote it down as something, I thought if it's good for him, it's good for me, it's good for all of us. Good people want to be held accountable. True. They want to know that they're doing well, they want to do a good job, and they want to be accountable for it. You know, and just off the cuff, I wanted to say, you know, when your kids go to school and they work in teams on team projects, and they're held accountable, there's that moral lesson for the kid that does all the work for the rest of the team, and then the team doesn't do anything and that one person does. And should they go tell the teacher? Should they just do their good job? And this is one of those lessons where they want to be held accountable and they want to do a good job at all costs. What does that look like in a team setting? And so I might play that exercise with your team so that everyone sort of pulls their weight. I find accountability to be extremely effective in companies where the leader is interested in that topic, if that makes any sense. It does for me. I hope it does for you. And then fluctuating business needs. Now let's get into some nitty gritty for a moment, because I really think we have to talk a little bit about this. And I know everyone pulls out the CPAP card, but let's just do it for a minute. Go with me on this. Just how do we find opportunity in our resources? And this was in talking to several providers. CPAP orders were down initially for some of the providers with whom I spoke, they said 50%. Scary, right? Kind of scary, but that task force was in line and they were checking in every day and looking at, you know, how much cash was coming in. And then they realized, wait a second, we have an opportunity here. We can retool some of our staff during this time when we're not getting those CPAP orders. So let's use the 50% of the people that were on it to stay. And then the other 50%, let's have them work on what you might call rainy day projects, or some of you called it spring cleaning, cleaning out of receivables, looking for ways to generate additional revenue, looking for correspondence that wasn't responded to, worrying about timely filing that's coming up, looking for erroneous payer errors, looking for, did we handle that recoup? What do we do with it? Etc. We could go on and on and on, but there's so many opportunities. Cleaning up the price file, making sure the payers are the same. Maybe some of the payers can now accept electronic claims that weren't able to do so before, those small mom paws. I could go on and on and on with projects. But what did it prove? It improved the employee versatility in addition to the bottom line. That is fantastic. I love that result, because what did it do? It created this ability to cross-train at a time we didn't even expect it. And then we created a more versatile workforce and a depth and a bench and an opportunity to shine in times when we otherwise wouldn't have had time to do that. You know, we hire out of desperation, or we work out of desperation. And in this particular case, we actually had time to take to take a look back and step back and come back in and say, what can we do and what can we accomplish during this time? I guess you could equate it with, did you clean out your closets during the pandemic when you couldn't go out on the weekends? But let me just say, for those people with whom I spoke, CPAP orders are thankfully back at 95% of pre-COVID figures, and we're back on track. And that's a good sign. Plus, we're better suited for it now because we have better efficiencies reached inside the operation as a whole. And I can't neglect this. I must speak to it because it's really something that I think we've all experienced, and that is telehealth. And we know that from CMS's rules and requirements as part of the pandemic, that in-person, obviously in-person, first of all, in-person visits to doctors were extremely problematic initially. The doctors just weren't there. Some are coming back slowly, and they may be behind in visits, but I have to say that they're getting better and better. But that, we're seeing more and more in person. I don't know what the difference is, but I would ask you to measure that also from like the initial part of the pandemic to where you are today with regard to physician visits, because those physician visits and those surgeries and those procedures and those other healthcare professionals are the ones ordering the DME that creates our orders. So how are they doing that? Are you still seeing a a predominance of Zoom and FaceTime and type of visits, or are they going back to in-person, or what's the percentage? Because why? Because I want to know what it's like for you. The truth is maybe you have the same. I'm hopeful that you were able to take advantage of the video and audio, the loosening of the requirements, or at least the acceptance of the audio-visual setups that we were having, and trainings and that we were that we are allowed to do, and the relaxation of those requirements per CMS. Of course, HIPAA security has to be addressed, and I'm assuming you make sure that you engage in those kinds of activities before you accept or sign contracts with any of the above. And so my question to you is, do you think that this will stick, the post-pandemic allowance for telehealth? Do you think it'll stick? I'm so hopeful. I think it's been really efficient for all healthcare professionals, and including HME providers. And I think that people are saying to me that, speaking with someone the other day, they said that they are getting so many more setups done than ever before because of the telehealth provisions. So keep track of that. I think it'll be really interesting to see. I feel like your benchmarks are just, you're probably off the charts with regard to KPIs and goals in that particular way. And then the initial outcome, I think that substantial increase in productivity and also compliance, measure against that to make sure, and of course, always get the documentation that you need to make sure that the item is reasonable and necessary, and the documentation in general that you have in your records, because you will be audited, no doubt. And even though they say they've loosened some of the requirements, I would at least attempt to get them. And when I can't, I would make sure to document it as COVID-19 and the reasons why you couldn't get it. So just a little bit of an advertisement for audits. Beware. When it comes to customer contact methods, we talked about how we're staying in contact with each other and employees, and how about the customer? How are you dealing with them? Are you doing, of course, you're getting emails now all the time. Someone said to me that 98% of the time, this is a provider said, they're getting emails, that people have emails. So it's almost unanimous that they have that, and some of them have, most of them then also have cell phones, and that they're definitely enhancing their text messaging systems. Again, HIPAA security at the forefront. And some have portals that they're starting to use for people to sign on to and to do reorders from. So that would be lovely if you can have that. Of course, phone if you need to, just because some people still get confused and some would rather have a phone call. But when you're taking the initial intake, you need to ask them their preferred method of contact. And I would also have it in a hierarchy, like first choice, second choice, third choice, because the last choice should really be a letter, to be honest. It just is, mail is taking so long, and making sure that it's getting there in time to get them what they need it's just so important. But the objective here is to reduce patient confusion and complaints and excessive calling. And one of the provider outcomes is, and I love this, I don't know how you feel about it, but text messaging that they've employed. It was an initiative during the pandemic especially. They really ramped it up. They reduced customer calls by 75%. They said they're getting literally 75% fewer calls. If that isn't music to your ears, I don't know what is, because when I go into your companies, whether it's a Zoom into your company or in person, I'm telling you, the number one complaint I always get is customer calls. So I have to say that is just a beautiful outcome, and I hope you take that to heart, and that maybe that'll work for you as well. And one of the things I wanted to mention here is with regard to phone numbers and emails. A lot of people don't pick up their phones anymore because they expect it's a robocall, or their cell numbers are no longer the same, and maybe they've changed, or their email addresses have changed. There are companies that will scrub that data and give you the actual correct phone number or text or cell number or email. You can do it through artificial intelligence, and there's also software that you can get a hold of to handle that. I would suspect some of you have already taken advantage of that. When it comes to customer rewards and things like that, we talked about how to get a hold of them. Maybe we want to start rewarding the customer. I think that's kind of cool. Someone said last week on a call that they are giving out $5 I think it was Starbucks gift cards when they return equipment. Cool. I think $5, when I think about how much it costs you to go to the home versus $5 for a Starbucks gift card, fantastic. For others of you in other areas where there is no Starbucks, so maybe it's $5 to the gas station, or maybe it's $5 to the grocery store, or some local establishment where they can grab a sandwich. Whatever it is, whatever, and again, maybe you want to survey a handful of your customers and ask them what they want, or a smattering of them. Or gift cards for curbside pickup. That's something else you could be doing. I know that when I go to a place here and I do curbside pickup, they gave me a discount coupon for a future visit. So I thought that was cool. Maybe use that. And then also virtual patient training. Maybe you want to give them some kind of reward, or at least if you come to a virtual training, we can see you in this time. But if you want to wait for someone, then it'll take a much longer period of time. Maybe that's just a reward, an incentive, or whatever for that. And also better touch points when we have the virtual patient training. We'll actually touch base with you on several occasions. And so just thought I'd throw that out there. Those are some ideas, and I thought they were pretty cool. And some people just give $25 gift cards. This was happening before even the pandemic. When I was doing a seminar somewhere, they said, hey, how about a $25 gift card, just a Visa gift card for returning the equipment, because it's cheaper than me going out there. And that was, when you think about it, there's things we have to do to be creative, and that's just one way. And then I wanted to, sort of let you know, there are areas where we continue to sort of experience weaknesses. You know what they are by now. You're seeing them. They're probably more pronounced in the work from home setting. What are they? How do I know? Well, here's how you know. You have benchmarks, you have KPIs, you measure against them, and they're based on skill set and depth of steps. So where you've got denials that are at 20%, that's not good. You know that your AR over 120 is at 30 or 40%, that's not good. You know that you're holding on to orders for documentation for 10 days, that's not good. But maybe the rest of the time you're doing a great job. Maybe other areas you're doing great. Maybe they're dispensing product that my drop ship is going great. It could be all kinds of different things. What I want to know is, though, where is that area of weakness, and where are your strengths? And establish the needs, the resource needs. What's it going to cost me to ramp that up? What's it going to cost me to solve for that? How many people do I have to hire to get that AR under control? Maybe I should reallocate the staff in the billing department. Maybe I should change the seats on the bus. Maybe I should ramp it up to then sort of measure against it and see what I really need. But maybe I just should outsource some of it in lieu of that constant deficit that I experience. And you see this most often in the billing and collections area. Part or all of it can be outsourced. We don't think about that, but in this day and age, we can just peel away at the piece of the business that we don't do well. And I've seen it all over the map, but even things like one of these payers that is just, such a bear for us, and we just don't have our staff, or we don't have them anymore, or they left, or they're not able to come back, or something happened to them during the pandemic. Outsource it. You could take that piece and outsource it. Or there's one company that might have these sort of random straggler payers, and they're just too hard to get a grip on because they're just, they're all over the place. Maybe outsource that part. Some of you are outsourcing insurance verification, which is kind of dicey today. Some of you are outsourcing, oxygen, or CPAP, maybe it's the CPAP compliance piece. It could be all over the place. All I can tell you is you should know this. You should know your strengths, and you should know your weaknesses, and look at outsourcing, especially when it comes to administrative tasks. Because again, the last thing I want is for your really key employee to be working on admin tasks because nobody else is getting it done. And really spend your time focusing on your core strengths, because strengthening strengths I've learned, and I'm continuing to learn, and I continue to see is really where it's at. Try to shore up your weaknesses by having others take care of that for you and strengthen your strengths. So when I look at lessons learned, I say to myself, what are we learning during this pandemic? Things that maybe we'll want to keep going post-pandemic. What is it that is really helpful? One of the things I wanted to remark on is that if you're going to do Zoom meetings, not everybody in your organization is acquainted with it. much like they had for actually this MAMES session, have a tutorial. Have someone actually do a tutorial on how to get out of Zoom meeting. Teach your staff before the actual meeting. It saves so much time. Teach them what a camera on their laptop looks like, how to share their screen. And I know this sounds crazy, but I'm telling you, it saves a ton of time. And that time is worthwhile to you because, again, you're focusing on your strengths. And the other thing that I know for sure is that you have to have awesome leaders. They have to be motivating. They have to engage the staff. You need employee engagement today more than ever before. You want to have employee retention, you got to have employee engagement. They have to have empathy, and it has to be genuine and not this fake stuff. And, you know, even just that check-in, that daily check-in alone is something. When I listened to a CEO talk to a staff of hundreds of employees, and you could see in his face that he truly cared, and he talked about the resilience of someone's family member who had COVID and rebounded. It literally it gave me the goosebumps. It gave me chills just to see how in touch with his people he was. Listen to me, they feel your stress. I'm telling you, I feel stress. Sometimes you feel stress. We're not exempt, we're human beings. And I think you can say that. Be vulnerable, tell them, you know what, yesterday was a rough one, today's much better. I just got back on track today. And by the way, I'm using a meditation app. And imagine that, the leader says, and I'm using a meditation app. And it's going great. Have you thought about what works for you? Think about that. That's just so human. In fact, I wanted to tell you, my daughter who works for a company that is a billion-dollar company, and she works in HR, they just implemented Headspace for all their employees, gratis, as part of their reward or their perks or their swag. And they had, I think they had people sign on in the first 3 hours, 17% of their overall employee base already signed on. So that was really cool. Something just to think about, but always wear that human side when you know you need it. And that's like being in touch with what the other person's thinking is so critically important today. So that well-being checkup, I can't emphasize enough. And perhaps you think I've overdone it. I don't think I can. Because when I talked to the providers that I talked to in our community, they all said that it was really about being in communication with their people and making sure that they had what they need to get their job done. So the key for me is reliable leaders. I can tell you that much. When I think about key takeaways, and even though this is my summary slide, I have to say to you, I have a key takeaway, and that is be transparent. Several of the providers I spoke with and many people in my other meetings have said, constant communication and making sure that you share information with employees makes them feel like they're part of a team. One guy said to me, he tells them everything, like this is really the health and sharing of our, sharing the health of our business is where it's at. It eliminates rumors and hearsay, gives us weekly and monthly KPI review opportunities. And that video message really is something that people come to love and expect. My husband, who works for a big company in real estate, does a video blog. His boss during the initial part of the pandemic came on every single day with a message in a meeting, and then an end of week sort of summary of where things were. So those daily check-ins and then those regular fun activities we talked about, and even surprises are great. That's fun. And then exhibit flexibility and sensitivity. And I think you'll see that it's really going to hopefully take you far. If you have taken one thing away today, then I guess I've done my job. I wanted to thank AccuServe for sponsoring today's session, and of course to MAMES for providing this space to be able to share what I'm so passionate about and have been and will continue to do for as long as I can. So thanks a lot, everyone, and hopefully we'll talk to you soon.
Hi, Miriam.
Hi, everyone.
It looks like we had a couple of great questions in the chat.
Good.
So just to remind people, go ahead and drop those questions for Miriam to answer live here. You can do so in the Q&A section, or you can do so in the chat, and we will read those for Miriam. So Miriam, I know you answered a few of the questions already. I thought there was a really good one in the Q&A that I think a lot of people would like to hear more on. So I'm going to jump back to that question really quickly. Do you think work from home will decline or go away with the pandemic, or are we witnessing a sea change in how we do business? And I saw you answered it, and I'd love to hear just a little more on that.
Yeah, I actually think it's going to stick. It's depending on the leaders. You know, talking, and I think I mentioned this during the session, I really believe that management didn't think it could be possible prior to the pandemic. And when I heard someone say I did a 360, A, because I had to, and B, because it worked, was kind of a shock in a positive way to the bottom line. And you know, we talked about the pluses and minuses, and I think there will always be those. And some people have sort of this pandemic fatigue and want to be in the, you know, the office to socialize, but other people say it's the best thing that ever happened to them and they're more productive than ever. So I kind of feel like it varies, but by and large, I bet there will be a sticking point upwards towards at least 50%. Where it's also helpful for brick and mortar from an expense perspective, not to have people sitting on top of one another, which I've seen in so many offices. And also the notion that we can be anywhere in this country or world for that matter and be working for the same company, I think really proves itself. So with the right technology, my answer is yes, I believe it will stick. And I think there will be a percentage where for all companies where they can sort of reach I don't know if it's like a happy medium or where it's a balancing act, but I believe at 50% or so, because when I talk to people today, I'm hearing that in some cases 50% of their staffs are back in the office. And for others, they're still at 80% out of the office. And again, like I said, it's staggered based on the requirements of the individual, whether they're immunocompromised, et cetera. But I believe it's going to stick because it's proven as a track record to hold itself stable with productivity. And if it's improved, you talk about whether if something's broken or not, and if it's really working, and it's surprisingly so, why would I alter it? And actually, if you talk, this sounds crazy, you talk to my sponsor, AccuServe, they will tell you they've been at a work from home model for many years, and it has proven itself over and over and over again to be very, very effective for the bottom line. And what I'm learning also is I was shocked to believe that I could do remote consulting. I thought that was gone. It has become so effective, but that's with a lot of flexibility and accountability. I've been able to manage it. I'm learning every day, and I think that flexibility, transparency, and effective communication, that daily check-in that we talked about is really, really key for the success of this. So I think you should look at other models that are working and see if you can adopt some of them and be adaptable. And yes, I believe it can work and will stick.
Awesome. And Steve just added to that what you had just said, and having people working from home and bringing everyone back, and in the meantime, people getting hired away to work from home full time. So some people are looking for that, it sounds like, which is great. A message from Carmen. So share with us, Miriam, what would be an exercise that you would pick first in regards to employee accountability?
Oh, an exercise for accountability. I'm just a believer in KPIs and goals, and I wouldn't pick a lot. I would pick a few, 1, 2, or 3. I would bring my staff in. We would discuss what they think they should be measured by, and I would go forward from there. So for example, documentation. If a team is gathering documentation, then I would ensure that it's coming in X number of hours or days, how many attempts I have to make till I get the accurate documentation, and how many sort of excessive documents we are waiting on at the end of a month. And let's say those are the 3 from which I choose. And then I let the staff come in and talk about what it takes to get the job done. And we might test it and do a pilot and say, how many of those documents can we retrieve in a day? How many in a week? and then what percentage should we expect to be left over when we're done? So are we getting to 80% of our goal or not? And then we can tweak it accordingly. So if that's what you mean by what I would do for accountability, something like that would be the case. When I think about things like insurance verification, which is all of a sudden becoming sort of the biggest weakness I'm seeing in various companies, because it's so convoluted with the various insurance companies, and within each payer there's different plans and groups. And I would actually drill down on my top 10 or 20 payers. I would look at how many are getting verified in what time frame, how they're getting verified, whether it's by phone, which is so archaic but necessary in many cases, and others that we're going onto a portal and able to gather the information, and how many I have been able to do in, like, is it a 24-hour turnaround or a 48-hour turnaround? And I wouldn't want it to be longer than that, so time it takes to get it done. How many are residual at the end of that period? And it better be very few if it were my company. And then, of course, based on the verifications, how many are able to get paid based on that? Or am I making, I'm saying they're verified, but then I'm not getting paid, so I want to check denials. So those are two very prime examples that come to mind off the cuff, and we could go on and on.
Awesome. I love, you are so well versed in all of it. It's so great. So we have another question here from Jim. What technologies are people using to manage employees? We use Smartsheet for communications and Terramind for Q&A training.
So what technologies are people using is the question to measure their employees. To be honest, and this is back to Jim, a lot of them are doing it sort of by, like you said, Smartsheet or Google Docs or those, or the like, or Excel. But those that are actually getting into the bowels of their software are able to start measuring in a way I never expected. So in working with our industry software, the two of them big ones, I'm noticing that there are some analytics in there to actually measure productivity inside the software itself. Will they have to come out and use some analytics to get what they need? Yeah, for sure. But in terms of being able to use the technology within the system, it is actually there. Not as friendly yet as we want it to be, but it's coming, I'm positive. So I like that you mentioned here, Jim, that you use Smartsheet, which I've also seen other companies use, by the way, that were measuring this many years ago even. I remember being at a company up in the Pacific Northwest, and they were definitely using Smartsheet to measure. And then Terramind, I am not familiar with, but I love that from a Q&A perspective. So thank you for mentioning that. And if anybody else has one, obviously chat us here. And I don't know if there are other questions, but I have other thoughts that have come to mind during the session. I was taking notes during the session itself, even just because I wanted to speak to you about what I'm hearing out there. I have this article on why the most productive people don't always make the best managers. And it's also, I don't know why I tend to get these when I Google them, I get from Harvard Business Review, and it's an article in Harvard Business Review, but they say the key issues are communications. One of the most critical skills for managers is their ability to present their ideas to others in an interesting and inspiring way, and engaging manner. A certain amount of communication is required for the highly productive individual contributor, but communication is not the central core of their effectiveness. In other words, people have to be engaged, and you have to communicate. I'm pretty sure, and in fact, I'm very sure that together with those accountability measures that Carmen mentioned, you have to communicate back. So if you ask them to measure against what they're doing, and then you don't go back and review it, why should I care? Why should I do it? I talk about this all the time. When I worked for my in-laws when I was young, and they asked me for a report every week, and I gave it to them week 1, I heard nothing. I gave it to them week 2, I heard nothing. Week 3, I got pissed. I'm like, I'm spending all this time to give them a report, and they never asked me about it. So week 4, I do this little experiment, and I don't give it to them, and they never asked me ever, and I stopped doing it. So please, if you're going to actually measure your staff, then I would ask you to actually review it with them. So I would say to you, weekly at a minimum. If you really can't get to it, then you want to get to them monthly, depending on where you are in seniority. But you have to show them, first of all, that they're deserving of your time to discuss their productivity and whether or not they meet their KPI that they helped set. They want that review. They itch for it and they crave it. And especially during this pandemic, they are just literally, starved for your communication. So please, as leaders, don't neglect it. It's, even if you think it's overkill and it might take 5 extra minutes, do it. And then train the next person down the line to do the same. So in my mentoring and coaching business, I have my leaders picking the next person in line to develop. And by the way, those KPIs and the things that Jim talked about are essential to be able to share with them how well they're doing. So, when we talked about even things like AR, we look at the top payers and where they're missing the boat. So look at the top areas for denial. I'm a huge believer in working from denials. And if you find that you're able to get a hold of one payer better than another and you just don't have the staff, then you might want to outsource it. That's where you say, hey, we do this really well, but we're really poor at managing this payer. It's just one of those we can't get a grip on. Why don't we outsource that piece? That alone could save your company. I had occasion to meet with someone out my way who said to me, Miriam, we have honestly all but outsourced everything that we were not good at. We realized that we need to keep the people in our company to be the best of the best. And where we weren't the best of the best, we just outsourced, and it's really been effective for us. So he was really grateful for that. And I don't mean to belabor and continue talking if there's some Q&As going on. Someone said they use Volate or Volate, V-O-A-L-T-E, to keep communication open with the teams. A lot of people use Slack as a Volt. Thank you, Carla. Volt, V-O-L-T. A lot of people use Slack in the companies that I talk to, by and large. I think that's the one I hear of almost every single time. But that's nice to have something else to compare it to. And I really wish I had some of the other names that you guys are asking about, but if you email me directly, I'll be glad to do some networking for you and do some research on some of the companies where I consult and have gotten some great information. Anything else here?
Yes, just to add to that, Miriam, you guys, as you're, after we wrap things up today, if you are looking for contact information, the slides are available and you can click on Miriam's link in the actual platform. So I do have a question from Rose, and I'm curious if she's asking about me, but you guys, only a few of you will understand this. If you have employees doing the same job, one at home and one at the office, should they have the same expectations?
From my perspective, yeah, they should. Depending on, I guess I would say to you, Sarah, if you're also in charge of answering questions of people, so then they wouldn't be the same. If you're in charge of answering questions from people at home and you're not at the office, then that isn't identical. Then I would have different goals. But if they were identical tests, yeah, I would actually measure them the same because I want to know the difference. Some people, by the way, do a far better job being at the office, and some people do a far better job being at home. And someone early on during the pandemic emailed me, someone in the Midwest, and said, Miriam, are you seeing an improvement in productivity, or are people waning in productivity during this early stage? And I wrote her back and said, look, not everything is equal, but I'm hearing a surge in productivity. I'm hearing people are doing great. I think more so, like I said at the beginning, than at the end, but meaning now, it's not at the end, but during now. So I see a little bit of fatigue right now, and I think we need some more motivation, and some of the ideas I gave you would be great. I love that idea of the Google survey so that you can find out what really makes people tick. And by the way, Sarah, I love the fact that your mom wants to know about whether or not it's the same job. So I guess we'll have to talk offline, Sarah. What can I say?
That sounds great, Miriam. I have a question for you, actually. What has been your biggest challenge in your journey working from home and working with people?
So, it's funny. I am going to, be transparent. I've been working from home forever. So I'm so comfortable. What's really challenging is that now there are other people in my house working from home, and they're like hogging the space sometimes that I'd love to work in. So now I can't just be anywhere in the house. So that's one. And two, I think that sounds crazy. As you know, you can tell I'm so passionate and I love the human interaction more than anything. So at first I was really nervous about it. To be honest, I was kind of panicked. And then I realized just be you, and if it's meant to be, it's meant to be. And I started doing some videos, messages on LinkedIn, and then I realized I'm just going to go for it. And one of the places where I was scheduled to go visit for a consultation, the leader said to me, well, just do it. And I was supposed to go in April. And he said, no, you can still come. We'll just do it by Zoom. And I was kind of shocked, like, no way, he's for real? Really? He said, yeah, we slated for you to come. We have people ready. Let's just do it. And what I learned, Sarah, was that I actually, in some ways, am more productive doing it this way. And here's why. I don't have to run and catch a plane. And if I want to talk to someone again, I can. And if I want to talk to another person, because one thing leads to another, I have the luxury of being able to do that because I'm sitting at home and I have the time that I didn't have otherwise, because I would take a day to spend to go there and to come back. And because I'm not on the road, I can do it. So what I've learned is I'm actually capable of doing these things from a distance. The one other challenge that I want to mention is teaching people how to use Zoom has been really challenging and requiring me to be flexible. And so what I've learned is sometimes I find that as well, that I also have a hard time sometimes getting onto other platforms. So I need to be equally, hope that people will be equally flexible with me. So I try to talk to myself before I get on. And the other thing I've learned is I don't require it, but I suggest that they teach their staff to use Zoom before I come into their office. And that's been effective to a certain extent. So thank you for asking.
Awesome. That's super fabulous. So with that, any last questions that anyone would like to throw out there? I'm going to use my teacher pause here for a moment.
While you're pausing, I'm going to throw out a couple of takeaways I got, just so not because I need to fill the air, but I had some things that I wanted to share. I think we need to respect how hard it is to work from home for some people. So I just want to reiterate that. Be transparent. They'll be transparent. If you're, as a leader, transparent, they will be also, or tend to be more so, and be flexible, like we said. And then also tell them when you're available. Like after 8 o'clock at night is not good. I know I think I've tried to reach Rose sometimes and she's like, Miriam, not now. I'm gone. It's after hours. I need a break. I'm on the way to, to the boat. And I'm like, oh my God, yes, of course. So what I find is we need to mark that, like the time that we're coveting, which is the time away from Zoom, and the time away from our phones and technology, so that we can be refreshed. And so I respect you, Rose, for that in ways you probably didn't even envision, but I really do love that you can every once in a while, not often, make a mark, separate the two. And so also that whole idea of a task force, I loved. Business Continuity Committee was such a cool name. Giving promotions or little coupons if you do curbside pickup, I loved, or return your oxygen equipment to curbside, we'll give you a gift card. Games that I hear, at least my kids are using online, Kahoot is a great game. I don't know if, Sarah, you've ever played it, but it's a really great game of questions. It's almost like a Jeopardy, or, like they did it for my birthday, and they asked the family questions and they had to answer, and it's done by your phone. So it's a fun sort of outlet. Another thing that I wanted to take away was 30 dashboards of how to learn about whether or not your people are productive and how well they are reaching productivity. And that person, 30 dashboards, I think was a Braintree user. People highly skilled doing administrative tasks is a big no-no for me. Teach other people to do that, and then develop leaders from under you. wrong seat on the bus. You know, when you have extra time now, throw people in different places and let's see what sticks. Maybe they have some assets and strengths you never knew about, and maybe they have a desire to do something a little bit different. That would be really fascinating to learn. I know for me, it would be really interesting. Love the stretch goal idea. And then again, the cross training and remember, you can outsource what you don't do well, even if it's for a time. Don't be afraid. Some people hate it because they think, oh my God, I'm going to lose control. But for other people, it's been this welcome relief that, you know, I know what I do really well, so I'm going to focus on that. And I think it's okay to be okay with that. Does that make sense? It's part human and emotional, and it's also, you know, quite transparent when you look at paper in black and white where you see where you're really failing. Let's try to shore that up and don't neglect that as an option. I hope that wraps it up and gives you a few takeaways that I actually got and thinking about this a little bit more today.
Absolutely phenomenal. You just did a lot of my part for me, Miriam, so thank you so much for being here today. And as someone who works from home, I can certainly relate to a lot of these distractions, and I love how you gave options for people to overcome that and to make those relationships and to still keep those connections strong with those who are away from the office. So thank you for that awesome wrap up, Miriam. That was absolutely fantastic, and I love how so much of it tied right in with what Richard shared with us earlier this afternoon. I'm so encouraged by what you've shared with us today, and I hope all of you that are walking out, here we go, of our virtual room today got some great takeaways as well. So again, I want to thank Miriam's sponsor and MAMES premier sponsor, AccuServe, for sponsoring this session today. So once again today, you guys will see that there will be a survey when we close this room. There will be a survey that pops up, and we would love to get your valuable feedback right away. So next up, I'm so excited to share that we are offering the MAMES 2020 virtual conference exhibit, which is actively open from 4:15 until 5:30. So once we exit out of here, I'm going to give you a few housekeeping tips. You'll be able to go to the exhibition hall. Many of the exhibitors already have their area representatives in your booth, so super exciting. Make sure to visit all of them. Here's how you can maximize that time. Please make sure to visit each booth and at minimally click the Leave Business Card. You'll see it right in the middle of the screen. You'll click the button, it'll automatically populate your information, and you can just leave a simple message like TY for thank you, or leave a more detailed message. You'll be able to earn amazing game points for each booth that you visit, and drop a business card too, starting today and running through noon on Friday. This is a fun, exciting thing. We are going to have a virtual Zoom drawing party where we're going to draw for all of our gifts and everything on Friday after the event closes. So be on the lookout this week for that Zoom link. Put it on your schedule for the end of the conference on Friday and get ready to party. But first, we have amazing drawings and giveaways from our exhibitors in the hall. So like I said, be sure to stop by everyone and support those who support your association. So with that, I want to thank Miriam again for this incredible opportunity to learn and grow from you. You're absolutely amazing. Carla says, where are the drink tickets and where's the bar? I can't help you with that one, but hopefully you have your happy hour bar sitting somewhere close, and we will see you all in the exhibit hall in just a few minutes. Thanks, Miriam.
And thank you again to AccuServe for sponsoring the session, and to MAMES for always making it just such an effortless opportunity. So I really appreciate it. Have a great time, you guys.